you very much, everyone, for finding time out of your very busy schedules, I'm sure, to be with us on today's presentation. I'll be taking us very quickly through a community engagement project I was a part of that I led. I am currently I'm a professor of adolescent medicine and health. I got this grant as after I had finished my PhD, which CARTA sponsored. I was in cohort 3. And the CPE project I got, as I'll be discussing as we go along, helped to amplify, I would say, the findings from my PhD research and from other research I had also done. So I'm happy to be here and to be given the opportunity to share. So I'll be taking us through an overview of the Gown and Town project, which was the project that I conducted as part of my CPE. Delta's Africa sponsored the CPE activity. Then I'll be looking at very briefly how the CP connected to my PhD research and how it has affected my career journey. And then I'll also be talking about some challenges and some successes I have encountered with conducting CPE and with using the learnings that I acquired from carrying out a CPE project. So going back to the very beginning, it was in February 29, because I remember I checked my mail, 2019, that CARTA sent out this call for the Delta's Africa Community and Public Engagement Seed Fund. And the fund was supposed to support the conduct of the mentioned innovative engagement projects that aligned with the fellows research projects. And the timeline to apply for this grant was pretty short. It was less than 6 weeks. And then I looked at myself and felt, okay, already I'm a community physician. So I do have some experience with conducting community engagement and working with community members. However, when I looked through the entire write-up that CARTA had sent, I realized that there was still a lot more that I could learn with respect to CPE. And that really spurred me on to actually apply for the grant. And so some of the things that CARTA had included in that call were the fact that they were very explicit about what engagement was. So there was no way one could not be aware of what was expected of one in applying for this grant. They also made a distinction between community engagement and public engagement. And so I think that helped in putting the proposal together. The other thing that the call emphasized was the fact that we were expected to carry out activities that would bridge the gap between researchers and non-researchers, and activities that would also provide channels for researchers and non-researchers to understand one another. The aim was said to be to maximize the impact of health research, ensuring research questions, methods, and outcomes are relevant to target communities and work to build a healthier society. Another aspect of community and public engagement, which was mentioned in the call, which I hadn't really been doing before, which I felt, well, this is an opportunity for me to hone my skills in this, was the emphasis on monitoring and evaluation. And throughout the journey of the CPE, this was really emphasized. And I would like to really say a big thank you to Deltas Africa for bringing all those of us that won the grants together to take us through sessions on how to ensure that our community and public engagement projects were not just random activities, but that we actually had a proper plan to monitor the activities, to monitor the outputs, to monitor every aspect of it. And I think that really helped. And that was something I actually really learned and enjoyed carrying out this CPE project. So now to my PhD. My PhD focused on the prevalence, the determinants, and the cost of health risk behaviors among adolescents. And so in putting the proposal together, I felt that a number of issues in the PhD stood out for me. The first was the fact that I had looked at costs, the long-term and the short-term costs of risk behaviors. And these risk behaviors were smoking, alcohol use, and unsafe sexual practices. So that for me was really innovative. But then I took a step back and felt the findings on costs will probably be more suited to a policy group. And since this was community and public engagement and not policy engagement, I decided to look for something else that I felt would be more attuned to a community audience. And so looking at the prevalence of health risk behaviors, another thing that stood out was the fact that These risk behaviors were consistently higher among adolescents who were out of school compared with those who were in school. And so I decided to wrap the community engagement project I was going to do around the fact that it was important for adolescents to be in school and the importance of this in their lives and in their development. And so I called the CPE project Gown and Town, Synergy for Enhanced Societal Impact. Basically, being an academic had been used to the phrase gown to town. But because this was going to be an activities in which I would be working with the community members, I decided to eliminate that hierarchy thing because saying gown to town is as if the gown, the academia has all the knowledge and is taking this knowledge to town. And so I was like, no, this is gown and town. We are working together for mutual learning. I was going to learn from them and they were also going to learn from me. And so the topic of the CP project I did was Gown and Town, Synergy for Enhanced Societal Impact. But then we then shortened it eventually to just saying Gown and Town. So what then were the objectives of the CPE project? In broadly was to engage with in and out of school adolescents and selected adolescent stakeholders as well to identify locally relevant enablers and barriers to senior secondary school retention, to prefer solutions to promote school retention, and then to provide the adolescents with the opportunity to present these findings at a stakeholder forum that we tagged Education is a Vaccine. So I'm coming from the point of being in school is protective against health risk behaviors. However, many adolescents are out of school. So then trying to look at what then are the things that promote retention in secondary school, senior secondary school particularly, what are the things that are barriers, and how can we mutually find solutions and then suggest these solutions to people that we know can make a difference. So I used various methods to collect the information. First of all, we selected participants from 4 schools and the community within the LGA. I think another thing that Delta has helped us to do as recipients of the grant was to manage our expectations. So initially, we'd been told it was going to be a 2-year project. Then we are told it was going to be run over 1 year. And so they helped us to keep it crisp, to keep it short and simple and interesting as well too. And so I focused basically on this. And then I obtained information from the participants using data work activity. Basically, the data work activity was put in place so that we could present information about the way in which being in school can be is a protective factor and the way in which out of school is a risk factor. So just basically presenting the data to them. Now, we know that there are different ways of presenting data to people. As academics, one of the major ways we do this is by having platform presentations. But when working with the community members, many times those platform presentations can end up being quite boring and you can lose people's interest. And so using the data work where the community members could go around, look at the data, discuss the data, we ask them questions, and then come back to plenary to discuss this, we found was very effective in introducing them to the data. Then we did a community mapping activity. On the right side of my screen, you can see a big community map that was drawn by teachers. And so we also did not want a one-sided story. So this was about retaining adolescents in school. However, we wanted perspectives of teachers as well. And so they drew community maps and identified on the community maps that they drew things that they felt could be barriers to students being retained in school and things that they felt could promote retention in school. Then we did a photo voice exercise with in and out of school adolescents. We wanted them to go into their communities and take pictures of things in their communities that they knew could promote secondary school retention and things that they knew could deter secondary school retention. And they took a lot of pictures. Another thing that I think helped was the fact that it was important to be curious for me as a researcher and to keep looking for what are the innovative ways by which I can get my participants to provide the information for this CPE activity to be successful. And some of the findings that we got from the adolescents are on the screen, and I just picked 2 that I felt were really interesting and 2 that I felt as a typical researcher, I wouldn't readily think about these as enablers or barriers to senior secondary school retention. And so for an enabler, an adolescent had taken a picture of a bank and then caption this picture saying that access to loans for parents to do business will increase school retention. So taking this beyond the fact that banks, you can save your money in a bank, to the fact that banks can actually give soft loans to parents. And when parents are empowered, they can keep their children in school. During the photo voice discussion as well, another of our adolescents said that banks can provide money to equip schools. So these are different ways that they felt banks come into play to promote retention of students in school. And so things like providing their parents with money and also providing money to equip schools, they felt were enablers to senior secondary school retention. And then barriers. One of the adolescents identified the gambling houses, the gambling outfits around, that allowing adolescents to gamble instead of being at school may make them decide not to go to school again. And also during the discussion, another of our adolescents said that measures should be put in place to ensure that young men who should be in school are in school and they are prevented from going into betting, knowing that when they start betting, and at that point, I think it was like the betting epidemic was starting out among young people or was being amplified among young people. And so they recognized that this was a barrier to secondary school retention. Now, after they then got all this information together, we helped them to synthesize it. And then we organized, like I said, the stakeholders dialogue to give the adolescents an opportunity to share their thoughts at a stakeholders forum. We had various stakeholders at this forum. We had researchers, we had adolescents themselves, we had their school teachers, we had senior officials from the State Ministry of Education. We also had school proprietors. So that we wanted them to listen to what our adolescents were saying and to hear from them firsthand about what could be done, what were the things they could do to ensure that adolescents were retained in school. Now, some of the outputs of our engagement. So we not only worked with adolescents and with teachers. At the onset, we had decided on what were the outputs we wanted. And some of these were one we wanted a research brief because we wanted the conversation to continue. And that was another important learning that I gained from the CPE project, the fact that you do not necessarily, or you are not necessarily able to do everything with this activity, but you want to start a conversation and you want to be able to leave your community members with tools that they can use also to further that conversation, tools that they can use to remind themselves of the lessons, and tools that they can also use to engage with other people in their communities to, so to speak, pass the message forward. And so we had the research brief. Then we also created a documentary and we created postcards that had messages for students, for parents, for teachers, for community members, and also for school owners. And all these items are freely available on the MESH website for us to download and take a look and see what were some of the outputs that we got from our CPE. Now, this is an example of one of the engagement cards. This engagement card targets community stakeholders. And one of our adolescents had said that church leaders can encourage parents to send children to school. Now, we know that in Nigeria, and I think in many African societies, faith-based organizations are key when it comes to health and passing along health messages. And so we had this adolescent who identified the church as an important community institution that could promote retention in school. So how then did this connect to my PhD research and my career journey? I believe that having these grants and being able to take the findings from my PhD helps to amplify the findings from my PhD. So typically, what I had planned to do with the PhD was definitely okay to have the PhD book that was going to be assessed and then to have publications from the PhD. But doing the CPE actually took my findings out from the typical channels that we use as academics and took it right to the community, to students, to teachers, to other researchers, and also to Ministry of Health officials. It also helped me to hone my skills in community and public engagement and has provided me with various opportunities to share my learnings with others. This is one such opportunity. I've also had opportunity to talk with people one-on-one about how they can embed community and public engagement in the work that they do. It has also helped me to really intentionally include CPE into other projects that I have been involved in, right from the conceptualization stage, all through the point at which the findings are disseminated. And so another important learning for me was that you don't need to wait until your results are out before you you have community and public engagement activities. Indeed, since the time I did this CPE, we have used community engagement a lot, having stakeholders meetings at the point when we are developing the proposals, because we really want to find out from the members of the community what really are their problems and what would be important for them for us to put into our proposal. We also have these stakeholders workshops to find out from community members what do they think their own role would be in the project. What do they think they can contribute? How do they think they can be a part of the project? And that actually has enriched our project, it has enriched our proposals, and it has enriched the work that we do. So some important notes that I also learned about CP in my CP journey. One is that CP is not a series of random activities conducted with community members. Many times you just think, oh, I just go and talk with the community members, I go in and I come out. No, CP is intentional. You need to think about what are the activities and what activities are best suited to the particular group that you are working with. Now, I happen to work with adolescents, and so I have to think and say, what activities do I think are suited to adolescents as opposed to what activities do I think might be suited to adults? Also, what activities will be better suited for adolescents who are in school versus those who are out of school, those who reside in rural communities versus those that reside in urban communities. Another important note is that one should manage the number and types of activities. If there are too many, it becomes unwieldy. Now, the great question is, what is too many? I think from reason of use, one can get to see what is too many. But many people will say not more than three, 1 to 3. But usually, as one goes along in the journey, you get to know what is too many and what is appropriate. I've also mentioned the issue about one size doesn't fit all. A number of people create videos. A number of people create could create social media content. But then one needs to stop and think: would my audience be on social media? If they're not going to be on social media, there's no point going for social media as a means of doing the community engagement. Except, of course, if you think you want to try to build skills in people that you know will still want to track to social media. Another important note is to remember the M&E. I mean, for this CPE project, we had to actually develop a plan. And if one does not develop a plan, it's easy to slip into the random activities aspect of it. And at the end of the day, it's difficult to know what exactly worked. And as researchers, you don't want to be stuck in the corner of just doing the same thing over and over and over again without really knowing whether it is having an impact or not, or whether you're just rambling and you're not really making impact. And then we want to know what are the activities that really work for your group of community members that you are working with. So looking also then at challenges and successes in community and public engagement, I would say maybe two main challenges. One is the issue about resources, and also the other one is being able to work with community expectations. Excuse me. Now, by resources, I don't mean just money. I think a major resource really is time. Time for the community members that you are working with. I mean, our community engagement projects are not their primary assignment. And so we need to be very respectful of their time as well. Then also money is important because you do need finances to be able to bring community members together. And then you also want to strike a balance between what is a good incentive to give to them for their time and for their contribution, and what then might slip into being like an incentive. And also working with community expectations. And also, I mean, so not just with community expectations, but your own expectations also as researchers. Sometimes we think that, I mean, in our own wisdom, we want to make the community members researchers, but they are community members. Yes, we can extend some things they can do as researchers to them, but we shouldn't fit them into the mold of researchers. And so we should also manage what we expect from our community members. Then sometimes community expectations can exceed what we can actually do. So for instance, when we did this community engagement project, the Ghana Town, we had some of the teachers coming to meet me. I had some of them coming to meet me to ask me to please help to sponsor some of their students that had dropped out of school. Now, I did not have the funds for that, and so I had to manage those expectations with a lot of wisdom. Some also would come and tell you to be part of their projects. Yes, that can happen. You can't be a part of the project, but you also need to know what can I commit to versus what will really be much more than I can commit to as a researcher. Looking at our success stories, I think I would say one of the greatest success stories we had was in getting the gentleman on the screen back to school. So he participated in our Gown and Town project as an out of school youth. And by the time he was done with this with the Gown and Town project, he told us he wanted to go back to school. I think what had happened then was that he happened to go to the university campus, and on that day they were having matriculation to take some pictures. And something just clicked in him and said, no, I want to go back to school as well. And so we were able to facilitate that process. We spoke with his parents who really wanted him to go to school anyway, but he had dropped out because he had been, in quotes, he had joined some bad gangs. And so we were able to facilitate him going back to school. And the last time he communicated with us, when he went back to school, he had been made a labor prefect. So I think for me, that is one of the greatest achievements I have had from being involved in community and public engagement. Now, other things I've been able to do as part of my CARTA postdoctoral program, my postdoctoral supervisor, Professor Frances Griffiths, encouraged me to set up a youth and adult advisory committee. Now, youth and adult advisory committees are also one way of doing community engagement. And I think this youth advisory committee has been really successful since inception. We have been able to work with the adolescents. They have worked with us on various projects as well, to conceptualization of projects, interpreting findings, and also planning projects. And so not just have they helped us in our research, I think we've also been able to help them to improve on their skills, improve on their leadership skills and their skills with respect to planning various activities for adolescents and youth as well. So last year also, as part of activities to commemorate the International Adolescent Health Week, my team and I worked with our Youth Advisory Committee members to create a brief video to highlight the important role adolescents play in the climate crisis. Also, as part of the International Adolescent Health Week, we set up a virtual debate called Verbal Vortex. And we got students to argue for and against the motion that climate change impacts adolescents more than other age groups of the population. Now, using debates is also another way to take your research findings to community members, especially community members who are able to argue for and against a particular motion. And so we are hoping that we'll be able to continue having this verbal vortex, because the adolescents, we are really excited about this, and it happened online. And so who says that debates should only take place in person? We also learned this as part of what my learnings from the CPE I had done before. So my closing thoughts then. One is that community and public engagement has to be about the community. As researchers, we have to keep this in mind. It is about the community. It is about what they consider to be important problems that they want to fix. It's about working with them, being respectful of their time, and also helping to hone their skills and being humble enough to learn from them and to acknowledge that we don't have monopoly of knowledge as academics. We have a lot to also learn from our community members. And then the second thing also is that we must remain curious. There are several questions that still need to be answered. And so when we are curious, it helps us to put ourselves out there, and to look for other questions that we need to answer working with the community members. And finally, I'd like to acknowledge all community members who've been part of various community engagement projects I've been a part of as well. I'd like to acknowledge CARTA, Deltas Africa, AAS, and my primary employer, the College of Medicine, University of Ibadan. Thank you very much for listening.
Wow, thank you, Adesola. Quite a picture of how you undertook the process of community engagement. And actually, that what you are saying today is that it can enhance or increase the effectiveness of research in having real outcomes. Two takeaways: it is intentional and it has to be about the community, and you've demonstrated that. And picking up because we don't want to just, when you finish a research study and you do the community engagement and it ends there. When we speak about sustainability, what are some of the major challenges that you've encountered in sustaining the long-term partnership with the community, and how have you navigated this to ensure the ongoing collaboration?
Okay, thank you very much. So I'll go back to what I said about the challenges that one can have, resources, and then managing community expectations and managing your own expectations as well too. And so to answer this, I'll talk about the Youth Advisory Committee that we set up. And then incidentally, we also set up an adult advisory committee. And so for the long term, I think that one needs funds because you cannot keep calling community members to meetings, even if they are online, without giving them something in return. At least without paying, if it's going to be online, we try to pay for their data costs. Never mind, many of them actually then decline and say, oh, no, they don't want those data. They don't want the cost for, they don't want to be reimbursed for the data, that they can afford to actually get their own data. But some of them do need this data. And so, yes, the resources are there too. Like I mentioned, the time. So the experience we had with the Youth Advisory Committee we set up was the fact that we also had to be flexible with the time of our youth committee members. One of them actually opted out after the first meeting we had because he got too busy with his studies. Another one relocated outside of Nigeria. So we just had to understand that even though they all wanted to be a part of it, they couldn't all be very active all of the time. But reasonably, I think we had great participation from them all at various points and at the different activities that we also carried out. So I would say the issue about time is to be respectful of your community participants' time and to be flexible. Sometimes we would invite our committee members, for instance, to programs they wouldn't be able to show up. Well, one will show up instead of two, and we're happy to go along with that. Sometimes also in planning online activities, some of them would be able to plan and some of them wouldn't have so much time. I think another thing also to help community members stay engaged is to give them roles. And so for our youth advisory committee, what we did was we had roles. So we had a chairperson, we had a vice chairperson, we had somebody in charge of entertainment, we had some of them perform roles of moderators at some of the events. And so I think having those roles for them also helped. Then also being able to step back and assess what it is you have been doing after a while. And so currently we are trying to assess this. We've asked our youth advisory committee members what do they think we could have done better, and we have braced ourselves because we know that everything may not be nice and rosy on their end as well too. And I know that one of the things they mentioned was the fact that they wanted a lot more in-person meetings. So because we had set up this committee during COVID, a lot of the meetings happened to be online. So they wanted in-person meetings. Also being able to piggyback on other projects. And so we've tried to, over the years, because we set up these committees in 2021 and this is 2025. So what we have tried to do is to embed the activities in other projects. And so as I get other projects that require an advisory committee, I go back to the youth advisory committee and engage with them. And that has, I think, helped to sustain things and sustain the tempo. Also working with other colleagues. So sometimes colleagues also ask me, oh, do you have young people that can attend some of our programs? So I go back. So I think not doing the projects in isolation and trying to embed it into existing systems and other projects that you are doing also helps with sustainability and helps with the resources aspect of it as well too. Like I said, managing expectations is key. When they ask for funds, if it's something that we can do, we assist. We've had members of our adult advisory committee, for instance, asking us to help them with planning of programs that they also conduct, or asking us to attend those programs as much as possible. Also, we try to give back in that way because we don't want it to seem as if we're just taking away from them. And I think also, just keeping in mind the golden rule, do unto others what you want others to do to you. So just do to the community members in your different CPE engagement activities what you want others to do to you. I think that also helps really with the sustainability aspect. Thanks.
Thank you, Adesola. A lot of learning, and we hope that our participants are picking up one or two things. There are some questions for you in the Q&A feature, which you can address as we move on. But I would like to introduce you to our panel, and they'll be doing the introductions. And probably I can start with Rose, just picking up. Adesola has talked about the needs of the community needing to take the front line. And Rose, if you can just come on screen. Thank you. As you introduce yourself, thank you. As you introduce yourself, probably you can tell us how you balance the demands of academic research with the need for flexibility, as Adesola has mentioned, when adapting to the needs and inputs of the community. But I can repeat the question once you give us a little background about yourself. Welcome.
Okay. Thank you very much, Anne. Thank you very much, everyone who is here with us. Now, my name is Rose Opio, as Anne has introduced me. I was cohort 1 in cohort 1. And the reason why I'm here today, it's because last year I saw a call for a community and public engagement grant with Science for Africa Foundation. And so I put in my application and I won it. So I was very excited about this. My proposed study is actually a follow-up to my re-entry research grant on adherence to that prescription among patients with kidney disease. Although I had previously engaged a lot the key stakeholders with my research, all the way from the research proposal stage through to research findings and publications, I still felt that there's a gap. There's something that I needed to do with my research, and that was getting my research to the key beneficiaries. And these were the patients and the caregivers who I interviewed, who gave me the information. They are the ones who actually needed this information much more than the key stakeholders whom I shared my findings with. So that's why I was very excited when I learned that I had actually won this research grant application. And so back to you, Anne, you have asked me to talk about how do I balance rigor, academic or scientific research rigor, as well as flexibility. And to answer your question, first of all, I would like to pose a question to everyone. And the question is, does society have any say in the implementation of your research? Does society have any say, or the implementation is all you are the boss? You are the one who has to decide how to do everything. Do they have any say to it? And to me, I would say yes, because at the end of the day, who is the end user of your research output? It is the society, it is the community, it is the stakeholders, whom it's very important that we get engaged with them right from the beginning as we plan our study, as we do our proposal. And so a good research project normally is one that addresses an identified research problem, and that is a societal need that you have identified, and that's why you get engaged in that particular research. You don't do research just for the sake of it. You do the research because there is a research problem that you as a scientist, you want to address. Yet, once we have identified that research problem and start planning for the research activities, we somehow forget completely about the word community or the society. And then we start now focusing on our scientific rigor, trying to do our very best, ensuring that our study is actually scientifically sound and meets all the documented and policy requirements, so that when you submit a publication, a manuscript for publication, it will go through without any questioning. And then when you look at the citation, the people who are citing your work, you get very happy because the numbers of citations are just going up and up every day. But then the question still remains, the key beneficiaries of your research. do they even know about it? So that's normally a very, very tricky question to answer for us researchers. And so if we have to involve the society and the community in our research with the goal of solving their identified needs that we are addressing in our research, we don't have to wait until the tail end and then say we are planning for a dissemination workshop. To disseminate what and to who? To the community, to the stakeholders. And who are your stakeholders? We always forget about the key beneficiaries, and these are the community themselves, the people that you have given you that data. So then how do we then balance the demand for the rigorous scientific research that we are always faced with the need for flexibility when adapting to the needs of the community partners throughout the research process? Among the things that I would say is that it's very important that we share the research plan and the methodology in a seminar or a workshop with the key stakeholders. And in most cases, we just do with the ministries, the national government, and the local implementing NGOs, but we hardly think about the community themselves. But it's very important that we also involve them and get their inputs and incorporate their inputs in our research design, so that we design our research together with these beneficiaries who are going to be the direct beneficiaries of our project. And that's the community, the public. And the other thing is that as we discuss the plan, the research design with them, we also have to discuss our research plans together with them. And one way of ensuring that we have incorporated the community in our research is we could actually use the mixed methods research designs. That allows and gives us a lot of freedom to be able to engage as many of them as possible, and at the same time ensure rigor in our research process. So you could use the explanatory or exploratory or sequential embedded research methods, and so that you collect both the quantitative and the qualitative data. And in the process, you actually ensure that you are not just focused on the data that you are collecting, but you are also actively engaging the community in the research process. And so as we do so, it's very important that we plan and work with the community's clocks, the times, and the event calendars. Rather than us taking to them a plan and saying that next week or next month we plan to have a workshop, and this is what we are going to discuss in the workshop. We plan to have a research. Try to discuss with them and find out what is the most appropriate time that we can have a meeting and discuss together some of the health problems that affect them, and how can we plan a way forward to conduct the research on it. So during this process, we have to learn to listen to what they are saying, learn from them, try to build their trust, because in most cases, they may not even trust you what you are asking them to do. So they will give you the information, yes, but they're not sure. So it's very important that we are able to gain their trust as we listen and learn from them and fit our plans with them. Then once we've done that, we can then incorporate whatever information they've given us into our research design. And that's why I say that when you have a mixed methods research design, you have the leeway of integrating whatever information that they've given you that will ensure that your research remains scientifically sound. So once you've done that, then we can then be able to replan a practical and contextual research plan that is based on the communities, all the key stakeholders' inputs, so that we don't ignore them. Because believe me, if we ignore some of the inputs that they've given us, later on, after you have already collected your data, you've done your write-up, you've done your beautiful publications, and then now you want to now go back and share the findings with them. And they'll be like, but during the planning, we raised these issues. How comes you are not hearing anything concerning some of these issues that we had raised? So it's very important that we find a way of incorporating their inputs in our study, but at the same time ensuring that the study still remains scientifically sound. And so in the process, we must therefore keep an eye on the trustworthiness of our research process in terms of the credibility of the research, the whole research process, and not just credibility of the data that we have obtained from that research. Also ensuring the transferability of the research findings. Look at the study, the research participants' characteristics, and see whether our findings can be replicated with a different population or not. And in the process also, it's important to think about the reflexivity of the researchers themselves. Think of your own characteristics as a researcher. Do you think some of your characteristics might contribute to the bias in the whole research process? What about your your research assistants who are going to help you in the research process? So we have to think about all this in the context of trustworthiness of the whole research process. And in so doing, then we'll be able to balance the rigor of the scientific research as well as the flexibility, being flexible in incorporating the community's needs as we try to address their problems that we assume to be addressing in our research. Thank you very much.
Thank you, Rose, for those strategies, which I can sum up to having a participatory approach in data collection, validation, dissemination, and finding practical and inclusive solutions. When we think about CPE, it cannot be without resources. And for me, resources would be about money and funding. And that is why we have programs such as Deltas Africa that is giving our fellows and other early career researchers funding to conduct CPE. And Henry, probably you can give us some pointers and strategies towards securing funding for CPE, which is often a challenge. But how we can't just say it's a challenge and give up. How do we go to secure some of these resources? Welcome, Henry.
All right. Thank you, Anne, very much, and thank you to our main presenter, Adesola, and of course, Opio, who has just won a grant. So I'm delighted to share my insights and my experiences since I completed my PhD in terms of where do we source for funding for CP activities. First of all, I think we have a good conducive atmosphere amongst the research funding landscape, because there's a new notion that research will now be about societal impact. This is what has been thrown around a lot about the need to have impact with our research. That funders are not only are happy with us publishing in the Lancet, publishing in Nature, that they also want the research we do to impact human beings, real human people. So there's this move towards moving towards people-centered, human-centered, or patient-centered approaches to research, and that involves our research having some way it kind of synergizes or impacts human beings, real human beings on the ground. So that's one of the good things, that funding is available for some donors. And in fact, some funders do actually emphasize that you have to have a CPE component in your research grant application. For example, I can give an example of Wellcome Trust. Wellcome Trust is really intentional about CPE, and they will not really look kindly on you if your application has no CPE and go public and community engagement. So that's already a positive thing. So even just looking at my own experience since I finished my PhD about 5 years ago, the grants have been able to attract from IDRC, from the WHO, from USAID, from Uppsala Monitoring Center in Sweden. I've always intentionally budgeted for CPE. So that's one thing. You have the power, by the way, to justify, to make a case for CPE activities in the way you budget. So first of all, budgeting is the one powerful tool you can do to make sure you have resources for engaging with the community. So for me, in the applications I've been able to make and which I've been fortunate to get, is I've justified why I need a CPE and how it links with my scientific objectives in my whole sense making in the overall interpretation and synthesis of my research project. So I think the reviewers begin to see the value that CPE adds to the science, right? So I think that's one thing to say, that it first of all, it begins with the researcher in using value in CP and therefore justifying its inclusion in the budget, and the donors will most likely say yes, And really, if you're going to do a huge grant, I mean a 3-year grant, 4-year grant, 5-year grant, really, I think that a CP activity is one that you can be easily justified, because it can't only be just about data collection, about laboratory work, about secondary data analysis. Really, there has to be somewhere where you touch base with a human being, a wananchi, as we say in East Africa, a common person on the street, And for me, I've found that I've always found that donors are okay with me including CP activities, my funding. Even for I think I've been able to attract 3 CARTA postdoc research funding by his grace, and I've always also included CP. Even CARTA, by the way, is also passionate about CP activities. And personally, I find CP activities are very fulfilling. They are very inspirational. And as Ade said, actually, you learn a lot from the community, from patients, from the community. I mean, you'd be amazed how much wisdom, understanding people have that we think as researchers they don't. But these are very smart people. They have got wisdom they have generated over a period of time. So for me, I find it fulfilling. So as a researcher, also it begins with you in terms of, before you even think of getting a funding, what value, what utility do you see in community engagement activities, So if you find the utility, then you make a case to the donor, and the donor will certainly finally say yes or give you a green light in terms of giving you funding. Okay, now let me be more helpful to people because I've been called to guide on funding for research. Now, I have engaged with UK universities, and the majority of the major UK universities, Oxford, Cambridge, Imperial College London, London School of Hygiene and Tropical Medicine, they are intentional about CPE, and they even have institutional funds for CPE. So if you have research collaborators in the UK, they have funding for doing CP activities in the low and moderate income countries. For example, I mean, in Uganda, in Nigeria, in Ghana. So that's also an untapped source of funding. So if you know a collaborator at London School of Hygiene and Tropical Medicine, and you have a good idea, I think, and you excite them and you really competently introduce the idea, they can approach the university to give you, not a lot of money, of course, because these CP activities don't really give huge grants. I don't see them giving you money beyond maybe $50,000. But if you have a $20,000 idea, talk to somebody at the Imperial College London, City College London. They know you to have built a name in your research area, in climate change, in NCDs, in HIV, in malaria, maternal health, and you already have a track record, and you say, listen, I've been doing research for 5 years, and I need to build in a component of CPE, and I wonder if we can work together, and we get a 1 year, 6 months project to engage with the patients in Uganda, to engage with the local governments in Uganda, in Kenya, in Malawi, or whatever. So also UK universities have these institutional funds that we don't take advantage of. I mean, you just take a look at Oxford University, look at their website, you'll be amazed. They even have institutional master plans for CPE. So I think that was something we need to tap into. But also, as I mentioned earlier, is that there are some donors who are deliberately for CPE. They require it of all their applicants, or all their researchers, people whom they fund. And like I mentioned, Wellcome Trust. Wellcome Trust. Of course, Africa Science Foundation for Africa is funded actually by Wellcome Trust mainly, that they are the main funders. So Wellcome Trust is interested in that. Gates Foundation also is partial to CP activities. UKRI, they're also open to funding. So there are some donors who really are very positive and about CP. They even, if you look at their template for their grant application templates, there's always a component for CPE. So they're already telling you that we need you to commit some funding towards CPE activities. Because as I said, people are tired of publications in Lancet. When you brag about published in the Lancet, published in, PLOS ONE, and, they also want to know that your research is going to impact human beings, people, households, women, youth, adolescents, real human beings who are impacted by research. So it's also good to know that these funders are there and they are willing to fund you for CP, and you have to budget for it. So a budget is really a powerful tool as well, members. A budget is very powerful. As long as you sit down and earmark some funding for doing some activities, and you don't really need a lot of money, like you people who do laboratory work and you have to get all these reagents. And I mean, you can build in a couple of US dollars to do some activities in the community, to engage with policymakers, and it doesn't take really millions of dollars. Like as I said, $20,000, you can do something very meaningful, something impactful, like Ade showed us, in Nigeria, that can be done. And in Makerere University, we have a Uganda government-funded research grant called Makerere University Research Innovations Fund. I've had a chance to look at their grant application form. It has a component of CPE. They actually ask you, how are you going to engage the community? How are you going to engage the public? So even within Uganda government funding to Makerere University, and I'm sure elsewhere in Africa, they're already pointing you towards the need to engage community. Because they cannot give you $1 million and it all went to flying you to Glasgow, to to New York, to these all elite scientific conferences, and none of it went to a mother, an adolescent in a rural part of Uganda or in Zambia or Zimbabwe. So I think that actually funding is available even within major donors that whom we know. All right. Then also there's something which is always underestimated is these private philanthropic organizations. Okay. Rosewood Foundation. They are American, especially in the United States. They are philanthropic foundations. Rockefeller, not so much, but these foundations which are run by individuals where they give grants, to researchers who have community engagement ideas, and as I said, you want small funding, $20,000, and you want to go and do some work to work with the community, to disseminate, to do co-creation. And as Opio said, you don't have to just wait to disseminate. No, CP is not only about disseminating findings. No, it's also about co-creation. In fact, in some research grants, they even give you money for you to co-create, to frame a research question, to design even research grants with people in the community, to contribute in the way you are framing your research questions. Even in terms of seed funding for reciting the grant, some people can even give you that money before you even submit it to NIH or a very major donor. So also private philanthropic foundations, especially in the United States. And I remember my supervisor at PhD used to always encourage me to apply for funding to not only to these research funders we know, NIH, UKRI, Wellcome Trust, but he used to have a list of private philanthropic foundations who fund researchers who are interested in this CP activities. And then also something that I thought we don't tap enough, embassies, members, these embassies, Western embassies, for example, the US embassy in Uganda, and even I'm sure in other parts of Africa, they have funding for not only NGOs, but even researchers, as long as you are community oriented, you are more impact oriented, you are more oriented towards engaging with the community. these people have established funding. Even the German government, the German, for example, the DAAD, they have been supported by the Germans for my various in my education career. And for example, DAD Nairobi has funding for researchers to do community engagement activities. Not a lot of money, but I mean $7,000. €7,000 to go and do something. But always they try to. Am I using too much time? All right. Yeah, but okay. So anyway, actually, I was coming to the end. So there are always these research sources of funding that we can tap into that we don't tap into. So, and thank you very much for this platform. Thank you.
Thank you, Henry. So many practical sources that we can get funding, but I think what you're saying in a nutshell is funding is available if the researcher is up to getting the funding and doing CPE. And then lastly, when we think what is the value of CPE, and our speakers have highlighted here and there, but probably, Damien, you can give us an example where we've had a policy or programmatic outcome from CPE work. I know you had your CPE work with Delta's Africa One and probably some other initiatives that you can tell us about. So welcome, Damien.
Yeah, thank you, Anne. Thank you very much, all the panelists and the attendees. My role here is to share some insights regarding the impact of the CPE approach. And my entry point will be that when I take CPE, I look at it as an approach, actually, that accommodates different methods, the methods we know, and new innovations. And the focus is on co-design, co-production, and also co-learning. So my first exposure to CPE was during it was an entry grant from CARTA. So I got the grant, I designed an intervention project. And my focus was to measure the change in terms of agents and the capacity of communities to enforce accountability at community level for improving services and proper use of resources. So that was a focus. And when I got the idea of applying for the CPE grant, I had to rethink the way I can utilize that opportunity to improve to learn something extra beyond looking at the outcomes, the practical outcomes of the project. So I had to sit down and with the community level stakeholders to plan, to think about the ways we can implement the community-based monitoring project, which was my re-entry project under the CARTA graduate programs. So we got interesting findings on the side of improving agents and the influence of community level stakeholders and communities on the availability of services, on the use of resources, and also on the capacities to influence decision makers and policy makers. But also we got, I think there were surprising findings and lessons regarding the impact on knowledge creation and knowledge production. And that is basically going to be my focus. The first thing that we learned in terms of the impact, it was that CPE ensures effective utilization of locally available resources. I think Rose has said that, but I'm just adding, there are so many resources, including the people themselves, knowledge, experiences, they can contribute in the process of identifying the problems they have, defining them, developing the strategies to address those problems or challenges. And that's very important if it is taken into account. And another thing which is very important as a lesson regarding the impact is that CPE actually exposes communities to science. And in that, we learn that it makes science something that communities, ordinary community members and community level stakeholders can do. It's not a myth. It can be done by ordinary citizens. And we can try to explore the essence of the concept of lay scientists and citizen science. It works a lot because in some of the communities, there are no researchers, but guided by scientists, they can develop competences and address the problems they have. A good example was the attempt of the communities I was researching to address the problem of housing for the health workers. They said, this is our problem. And nobody is going to come from the central government or the local government, which, of course, the power in our government system is at the council or the district level. Now they actually sat down, created a kind of partnership, and they agreed that they are responsible. So development of a sense of responsibility, that the problems belong to the communities themselves, and they have to do anything they can do to address those problems. In addition, there is acceptability and legitimacy of science and these scientific methods that use. When we design interventions and any kind of study, actually, any scientific study, there is a thinking, or even if it is a policy intervention, these are science, things for scientists. So sometimes they are not acceptable within the community context. So we learned a lot that CPE contributed to the acceptability of these methods, which are actually considered to be complex and sometimes demanding. Lastly, let me talk briefly about the development of partnership and as an effect of CPE. And that kind of partnership, I'm talking about the partnership that extends beyond the timing, the time you are implementing the project. We had this intervention was within health facilities, but because it is at village level where there is primary education, where it is organized and governed, even water. So they adopted the same approaches, the practices they were using, for instance, in terms of holding the committees accountable to school committees and even water committees in the villages. And this was 2020, but our follow-up after the COVID and last year, 2024, some of the practices, people are changing, the institutions are changing, but some of the practices are still there. It is because of the CPE. I think you also wanted me to talk briefly about what factors contributed to this kind of impact. The biggest factor, which I consider to be very important, is making the communities and community level stakeholders cognitively aware of the problems they have and why you are conducting the research with them. So if they understand clear what the problem is and actually the approaches, and that goes with developing the guidelines. beyond the monitoring and evaluation framework that we use in our projects, our CPE projects, you need to have the guidelines that are a reference for the stakeholders during the implementation. And actually, in addition, as they said, the previous speakers, making the project community-owned. We had the volunteers from the communities themselves. We had community advisory committee. Now these, they make the project community-owned and also contributes to cost effectiveness because you don't have to use a lot of resources in terms of money. There are people who can help to make the project activities proceed, even if you're not there or there is no funding. For instance, this was the COVID-19 session, 2020, 2021. But most of the activities were implemented by the stakeholders and they were able to generate the reports and share with us. So I think this related to the impact. Thank you for this time.
Thank you, Damian. Again, summing up from what Henry, Rose, and Adesola have talked about, the need for co-creation and for the community to have ownership, to be aware of their problems, and to actually work with them to, when you're doing both the research and you're implementing the CPE activities. And as we wind up from this panel session and go into the Q&A session, maybe I would like to ask the panel probably to take a minute or two. If I'm, for example, a researcher, and with the researchers we have on the call, and I'm just beginning CPE or would want to begin to integrate CPE, what would be your advice for me? And we can begin with Adesola. Just a minute, and Rose, Henry, then Damian.
Okay, thank you very much. So I would say three things. First is that community and public engagement needs to be intentional. It cannot be, like I said, random activities put together. There has to be a properly written CPE plan, which includes monitoring and evaluation aspects to it as well. The second I'll say is that we should be flexible in terms of the activities you want to carry out, be flexible in terms of acquiring additional knowledge about CPE. It's not something to just jump into after having read one or two documents about it. One should read around it and be sure you're doing it properly. Be flexible also about engagement, what you're going to take out of, the time you're going to spend with the participants as well too. And then finally, I would say remain curious. Curiosity drives us as scientists. Thank you.
Thank you. Rose?
Thank you very much. Thank you very much, Anne. My parting shot this evening on this community engagement process is actually, if you want to ensure that you integrate it in your research process, number one, involve the community in your research in the very early stages, including formulation of your research questions, very important. And listen and learn from them as you formulate the research questions and you start your research journey. And the other thing is on the research design itself. I think the mixed methods research design gives you a lot of flexibility to integrate the CPE in your research in a number of ways. So consider mixed method research methods, and always remember to involve the community, not just the key stakeholders, the ministries, the government officials, the NGOs. No, remember the key beneficiary, your study participants. Thank you very much.
Thank you, Rose. Henry?
I think, Anne, what I would do if I wanted to start off trying to engage in CPE activities, first of all, to learn about it, the basics around it. Also, if you notice, there's a difference between CPE approaches and traditional scientific approaches. So me, I'll try to read around these novel, new approaches to CP. Like Ade shared some, transit walks, community mapping, Me, I'll try and learn about these, And also another source that people don't, that I think that is untapped is published protocols. Me, I always look at the journal called Implementation Science, and it always publishes protocols. And always researchers always kind of, document how they want to engage with the community, and they have very brilliant approaches, So I would even read through that before I even begin of my own, so that you see how it has been done, how it has been embedded in the study, how it synergizes the rest of your research. So I would really read a little more about it, and there are many models to follow, even which are published, that I would, try and read more about before I even begin thinking about it. Yeah. Thank you, Anne.
Thank you. And Damien.
Okay, thank you. I have 2 points. The first one is how you position yourself as a researcher. Because you can take research as a career, scientific publications, academic conferences, and so on. But you can also take it as a way of, touching the lives, the people, changing livelihood. So trying to balance between the two has a lot of advantage. Sometimes the big opportunities we think about when we think about research as a career, they can be obtained through engaging with, making change, the change you make, the impact in terms of how you touch the lives, how you help the country, or the world in terms of solving the problems we have. And the second, which is, has to do with funding. I think when we think about doing community and public engagement research, we should not think about even millions of dollars or even tens of thousands. It starts with recognizing that there is someone who can do better using the resources I'm going to use on the same activity, research activity. Because if you have community level stakeholders and they get buy-in, they can contribute. You don't need a lot of money. So the cost you expected to spend during the fieldwork sometimes is bigger than what can be spent if you invest in these lay scientists. They can do a lot for you. So these two are my advice for those who are interested in community engagement and public engagement research. Thank you.
Thank you. Thank you, Damien, and thank you all our speakers. I think those ones are quite practical and great insights. I wouldn't want to belabor bringing all these strategies to a conclusion, but I would want to hear from our participants. I know the mic is disabled, but if you raise your hand, I'll be able to enable your mic if you'd want to ask a question or just make additions to what has been shared or discussed today. Yes, Gregory, please introduce yourself, your institution, and go ahead.
Thank you, Anne. I'm Gregory Sakwa from Masinde Muliro University of Science and Technology in Kenya. And I'm a young researcher who is getting to be involved in community-based research. Currently, I'm working with the communities to raise awareness about self-sample collection in cervical cancer screening. I've read slightly about community engagements, but I have got too much experience about it. And I'm struggling to come up with the community involvement and participation. I've already tried to form a community advisory committee to assist me, but because of lack of experience and exposure, I'm really struggling to know exactly what do I need to do in the context of high expectation from community members, from me, probably expectations which I may not be able to fulfill. So how do I go around that? Thank you.
Thank you. Rose, Henry, Adesola, who would want to help Gregory?
I'm happy to take a first shot at it. I actually saw the question in the Q&A and tried to type in an answer. So I think I would say that starting out with the community advisory board you have is it's a great step. You have identified one activity you want to do, so you're already keeping it manageable. So without your knowing it, you are actually managing things. Then, like CARTA asked us to do, like we're asked to do, sorry, for this particular grant, you need to write a plan. In the same way in which you wouldn't just go to the field and do your research without a research plan, I think you should not start a community and public engagement without a plan. That plan helps to make things really manageable. Then you also have materials online about setting up community advisory boards. Read up those materials and follow those steps as well. That definitely will help to keep things manageable. And then also at the inception meeting, let the community board members be clear about what you can do, what you will be doing, and what you will not be able to do, what will be the incentives you might want to give to them. Then you might also, since it's your first time out, like you said, let them know that the board is going to last for the lifetime of the project. That also gives you a nice way out if things are becoming too unwieldy. So set the tone. I mean, have your plan. Set the tone. At your meetings, let everybody have a copy of the expectations. Let them also know the exit point, which is the end of the project. That is a good way, I think, to make things manageable. And also, like was said earlier on, read around it online as well. So maybe on a final note is to encourage all of us here as well who have done community and public engagements to publish our work. That's the way young scientists can get to know what happens, how it can be done in Africa by Africans. Otherwise, we are going to be relying on community engagement procedures that probably do not really work in our own context. Thank you.
Thank you so much.
Thank you, Adesola. Henry, Rose, Damien, would you want to add something?
Okay, just to add on to what Adesola has said, building trust of those that you want to engage with is very, very key. Adesola has said it, and it's very important. Then find all ways of establishing a good rapport with these people that you're going to work with, because if you have not established that good rapport with them, believe me, you'll not be able to get much from them. Thank you.
Thank you, Rose.
All right. And I would also encourage members not to only rely on themselves alone in accomplishing this. You can get, people who can support you, people in the social sciences or people who have done it before, who can kind of be like advisors, technical advisors for you. You can reach out to them. They can help you kind of frame your project and help you to kind of, make sure that it's feasible and it answers your research questions. In fact, in some universities, they even have CPE offices, like community engagement offices, where there are professionals there who are there to support academics and researchers to craft their project. So those are entrepreneurs also that I would really engage and kind of try and get them to help me to work out a project I'm working on. So I think also the point I'm trying to make is that you don't have to do it yourself 100%. You can look at some mentors, some models within your university. People, especially in the social sciences, in public health, there are people who have done it before. They can be your scientific advisors. And also university offices sometimes have people whose job it is to support people in outreach, in community engagement. So they can really be excellent people who have built experience over years, who can give you some guidance on how to come up with your own CP project. Thank you.
Thank you. Thank you, Henry. We're almost winding up, but we can take one or two questions. Damien wants to add something Or do you want to take the next question from Okidu? I think take the next question. Yes, Okidu? You can unmute. Okay, I think he's not able to unmute. I've given you the permission to unmute, so please go ahead and unmute and ask your question. All right.
Can you hear
me? Yes.
Can you hear me?
Yes, yes.
Okay. I think it's a quite interesting session. My name is Onjefo Okidu. I'm a professor in Bowen University in Nigeria, close to University of Ibadan. I'm an APHRSC fellow, a very old one for that matter. I think it's a very interesting session. But one area I really want clarification has to do with M&E. Because most times we do this work, we don't even know whether it has impacted the people or not. So how do we position M&E in CPE? Did you hear me?
Sorry, Anne, you are muted. You need to unmute.
Yes.
Did you hear me?
Yes.
Okay.
Did you? Yeah. How do we position
really...
M&E in CPE?
Yes.
Yes.
Because
Damien,
I can see that it's very lacking in all our discussions today. It's not quite emphasized.
Damien, do you want to respond to that? Or Adesola?
And maybe Adesola can share with us how she incorporated the M&E in her project. I'm yet to start mine, and of course, it's very, very important. I'm going to incorporate it. So perhaps Adesola, share with us how you managed to incorporate M&E in your project. Thank you.
Okay, thank you very much. Yeah, very important question. I think I mentioned it also about the fact that it's really important so that one doesn't just keep churning out activities that don't have any impact.
Yeah.
And so for me, I think I had done some M&E training before. However, what Deltas did for us was to take us through M&E, and they gave us an M&E framework to use. So I think if you can link up with somebody, maybe in your institution, who is good with M&E to walk you through the M&E framework, and that is at the point when you are developing your engagement plan. And so the M&E framework basically takes you through so you have the title, you have what are the outputs, what are the different activities you are going to carry out. It has the definitions of the different types of indicators. So you develop indicators, you have definitions for indicators, and then you set like your benchmarks for them. So for every activity you carry out, you fill out your M&E form. So for instance, you have said you are going to send out a call to community members, asking them to be part of your community advisory board. Now, that is an activity. The indicator for that activity could be the letter that is sent out, the numbers of people that you send out the letters to, the numbers of people that actually respond and say, yes, they would like to be on your community advisory board. And you have set out those percentages. So for instance, if you had said you are going to send out letters to 30 people, hoping that 10% of them, or hoping that 90% of them, would say yes. You've set that as an indicator. So when you then send out the letters, you then write it. So that way you can see if what you are doing, if you're achieving any immediate inputs and outcomes as well. So all the way up. If I have your email address, I could actually look for the templates that we used and share it with you. It's a great starting point. But then like Henry said, don't try to do everything alone by yourself. If you can get someone who's very good with M&E and share that framework with the person, so the person walks you through how you can utilize that framework for your own CPE activity, that would be excellent. It will also save you some time.
Oh, thank you. That is beautiful.
Thank you.
Just a small addition.
Yeah.
Just a small addition. We know we have experts in monitoring and evaluation, and the evaluator is expected to be someone out of the project from outside the organization. But when you prepare your monitoring and evaluation framework, remember you are going to have several adjustments if you are doing CPE, because these milestones, the indicators, the activities, you are going to bargain them with these community level stakeholders. So that kind of flexibility is also needed. Thank you.
Thank you. Thank you very much.
Yeah, I think that's a very important aspect to look at. I see we are past the set time. So if you have any questions, please feel free to email me and I'll be able to share with the panelists for them to respond offline. Otherwise, I would really want to appreciate everyone who made time to join us and to our wonderful panelists. Oh, no, I meant Okidu share his email, but I'll share this with you. So I'll bring the webinar to a close. Thank you so much and have a good evening.
Goodbye.
Thank you.
Thank you, everyone. Bye-bye.
Bye.
Thank you and bye-bye.